Okay, so now the different drugs that we're going to talk about are going to be relating to the endocrine system. So I know that the endocrine system is quite complex, but we're going to talk about 3 different glands or areas that drugs are going to be working in. We have these areas divided into the pituitary gland, the thyroid, and the adrenal glands. So just to remember that endocrine drugs are usually given to act like or to stop a specific hormone from happening or being produced, being overproduced, being underproduced in the body. Whenever you have an issue with the endocrine system, you always need to make sure that your patient has proper diagnostic tests to either diagnose the hyper or the hypo function of whatever gland, because hyperpituitarism or hypothyroidism can have a whole host of issues. But we're just going to talk about different drugs that can increase or decrease the, I guess, act like a brake or accelerate a certain gland or area of the body. So we're going to start with pituitary, the pituitary gland. The first drug we're going to talk about is somatotropin, which the brand name is Humatrope. I guess that's how you say it. Humatrope. That kind of sounds funny. I don't know. I don't know. Okay, so this drug in particular is going to stimulate anabolic processes. So this drug can be used for skeletal growth. So if somebody has hypopituitary dwarfism, if the child has growth failure, and it can also be used for HIV patients who have wasting syndrome. So these people are children that aren't growing well, or HIV patients who are wasting away because of the disease. This can help the patient hopefully bulk up a little bit, gain some weight. So somatotropin is contraindicated in children who have closed growth plates. You're not going to want to press the accelerator on children that can't grow anymore. You only want to do this in children that still have open growth plates. And somatotropin, however you say it, it's also contraindicated in patients who have tumors or acute illnesses, as this drug can stimulate tumor growth. So don't do that. Adverse effects of somatotropin include hyperglycemia, hypothyroidism, hypercalcemia, and flu-like symptoms or a headache. Nursing implications would include monitoring the patient's baselines, especially weight. If you're trying to help your patient gain weight or at least stop losing weight, HIV wasting syndrome patients, or children who are trying to grow more, you need to monitor them. You need to monitor their height. You need to monitor their weight, make sure that the drug is hopefully doing what it's supposed to be doing. And the response that you would see is growth in children and improvement of the wasting syndrome in your HIV patient. So, I mean, that's pretty easy. You're trying to bulk these people up, trying to grow, trying to help them grow. So, I don't know. For some reason, whenever I see Humatrope, I think of I don't know why, but I think of the circus, like a human troupe of people performing or whatever. I really don't know why. It's a really odd word. And for some reason I think of circus, and a lot of circus performers could be like teeny tiny children that are running around on stilts and bicycles up in the air, or people that are really skinny and trying to do acrobatic stuff. I don't know. I just think of this stuff and it kind of helps me remember it. I really don't know the connection there, but whatever. Okay, whatever. The next 2 drugs that we're going to talk about are vasopressin and desmopressin. Again, we're still in the pituitary here, so these drugs are going to act on the pituitary. These drugs are not patent, but potent vasoconstrictors. So these drugs can be used for diabetes insipidus, and it's contraindicated in patients who have hypersensitivity to vasopressin. Obviously, you're not going to give them vasopressin if they get a hypersensitivity to it. Also contraindicated in patients who have seizure disorders, asthma, or heart or renal failure. These drugs are going to increase water reabsorption in the distal tubules and the collecting ducts. And the adverse effects was going to be increased blood pressure, fever, vertigo, and possibly a headache. Nursing implication is water intoxication, especially if the patient is drinking excessive water. Could possibly they could be intoxicated from it because they'll have too much water in their system. So there is a little bit of a difference between vasopressin and desmopressin. Desmopressin, the brand name shorthand is DDAVP, don't really know what that stands for. And then the brand name for vasopressin is Pitressin, maybe. So vasopressin is mostly used in emergencies, while desmopressin is for stable situations. This lasts longer, and it can also help with nocturnal. It can lead to nocturnal uresis, which would be urination at night. So you just need to make sure you let your patient know, like, hey, you're going to be going to the bathroom at night. The next drug for pituitary is Octreotide, which is sandostatin. This is going to decrease growth hormone release. So this can be used for kids with gigantism, acromegaly in adults, carcinoid tumors, and esophageal varices. So gigantism in children and acromegaly in adults is mostly because of something wrong with, or something to do with hyperpituitarism, whether they have a tumor on their pituitary and it's increasing the growth, the hormones coming from it, so hyperpituitarism, or if, I mean, maybe not a tumor, I don't know, something else that could cause their pituitary gland to go into overdrive. But this is going to help slow it down. So this is like a brake instead of the accelerator. The adverse effects can include GI issues, hypo or hyperglycemia. It just depends on the situation. Nursing implications include monitoring the glucose levels because you're monitoring for hypo and hyperglycemia. You even need to monitor this in non-diabetics because you don't want them to get into the diabetic range. The response is going to be a decrease in diarrhea with carcinoid tumor patients because this drug, for carcinoid tumor patients, they can have profuse diarrhea. So this drug can help stop that. Again, we're putting the brake on the body. A brake pedal, not the... Okay, whatever. Okay, the next category, or the next section of the body that we're going to be talking about are drugs that work on the thyroid gland. The drug here is levothyroxine. That's how you spell it, levothyroxine. Synthroid is the brand name. That's pretty easy to say. This drug is given to replace what the thyroid isn't making, so it can be used for all three types of hypothyroidism. So this is like an accelerator. It's trying to help the thyroid, or at least trying to help the body get what the thyroid should be producing. It's contraindicated in patients who have myocardial infarction, hypertension, angina, ischemic heart disease, but it's not to be used in patients who are obese. Adverse effects include tachycardia and cardiac dysrhythmias. The nursing implications are that this drug interacts with a lot of drugs. So you need to monitor, like you need to look at the patient's drug history and see what they're currently taking to see if that drug that they're taking interacts with this drug here. Patients must continue use of this drug during pregnancy, but it does need to be closely monitored. So nursing implication, if your patient's pregnant, tell them to talk to their doctor. Again, this drug is one of those drugs that they have to take in the morning because it can lead to insomnia. It's not going to deal with the bathroom trips at night like the diuretics did, but this drug can lead to insomnia. The patient also needs to take the drug at the same time every day so that there's a stable level in their body. So always taking it in the morning or always taking it right before lunch, whatever. No over-the-counter medicines without their doctor's approval. Again, there's so many different drugs that this drug interacts with. Your doctor needs to just look at it and say, okay, you're good to go. And this drug in particular can increase the anticoagulation effects of Coumadin, warfarin. So, I mean, obviously, if the patient's on warfarin, then the doctor's going to be like, oh, that's an interaction. We're not going to do that. So just some fun facts to know about it. And for this drug and other thyroid drugs and drugs that deal with endocrine system, the patient needs to tell other doctors like, hey, my endocrinologist or my primary care physician has put me on this drug. Can it interact with anything else? They just need to share the information from doctor to doctor to say, look, I'm taking this drug from this doctor and I'm taking this drug from this doctor. Can they interact? Do they interact? What kind of interactions will I see? So they need to share about like what their thyroid medicine use is with other doctors that they visit. And the response that patients would see is that they would see a decrease in symptoms of hypothyroidism. So hypothyroidism can include like sluggishness and weight gain. And I mean, there's a whole host of things that can go along with it. But ideally here we're trying to increase the thyroid, or at least increase the effects of what the thyroid would be doing by putting the accelerator instead of the brake. So the next two drugs that we're going to talk about that deal with the thyroid are methimazole, that looks like it, and profiluracil. I did not say that right, but it's short as PTU, which is pretty easy. And then methimazole is tapazole. They both have zoles, Z-O-L-E, so that's pretty easy. That's how you spell them. I don't know how you say them. But this is going to stop the formation of the thyroid hormone. This can help treat the cause of hyperthyroidism. So these drugs are for easing hyperthyroidism and Graves' disease, which can go along with hyperthyroidism. Adverse effects include liver and bone marrow toxicity, which can lead to hematologic agranulocytosis. Nursing implications are that you're going to want to monitor their liver lab values. Possible liver injury can occur. Hypothyroidism, so watch out for that because you're trying to slow down the thyroid. Don't want to slow it down too much. Patients should take this with food and avoid high iodine foods. Also, patients should take this at the same time every day to maintain that stable level. And you don't want your patient to stop taking this drug abruptly. Interactions include anticoagulants and digoxin, so kind of similar to the other thyroid medicine. They need to talk to their doctor just to see what kind of interactions this drug can have with drugs that they may already be taking. The last category in endocrine drugs are adrenal gland drugs, and there's two classes. There's glucocorticoids and mineralocorticoids. I can never say that. Here they are. There were really, really little space for me to write them down here, so I didn't write them in red like I do here. But here are the drugs. There's 3 here, and then there's one over here. Glucocorticoids, there's 3 drugs here: dexamethasone, hydrocortisone, and prednisone. Dexamethasone, the brand name is Decadron, and then the brand name for prednisone can be either Deltazone or Steraped. And then there are a lot of different formulations of hydrocortisone that I didn't list them all because there's like a million, but hydrocortisone is pretty easy to remember. So pretty sure I have some hydrocortisone cream in here in case I had like a bug bite or something. I don't even know where. Maybe it's on the floor. Well, I had some in here at some point. I don't know where they went. And then the one drug that we're going to talk about in mineralocorticoids is fludrocortisone acetate, which is Florinef. That's how you spell it. I don't know how you say it, but that's how I said it. Okay, so adrenal drugs can either be systemic or natural, synthetic or natural. They modify enzyme action and they control inflammation in the immune response. I thought systemic because mineralocorticoids act systemically. So adrenal drugs are either synthetic or natural. They modify enzyme action and they can help control inflammation and immune response. So they can be used for a lot of things, but not serious infections because they decrease the immune system in the body. Little exception to the rule is that they can be used for TB meningitis. So these drugs can be used for a lot of things, not serious infections because they decrease the immune system, with the exception of TB meningitis. So that's what that says. TB meningitis is the exception. I don't have a little star written by it, but just remember it can be used for TB meningitis. It's contraindicated in patients who have drug allergies, who possibly have heart, kidney, or liver dysfunction, and caution needs to be taken with patients who have gastritis, reflux disease, or diabetes. There's a lot of different adverse effects that can occur throughout the body from these drugs, and I have them listed here based on the body system that it affects. So affecting cardiovascular, we have heart failure, edema, and hypertension. Remember, we're talking about adverse effects of adrenal drugs. There's a lot of different adverse effects. They vary based on the body system, and I'm going over by body systems right now. So cardiovascular is heart failure, edema, and hypertension. This is because of fluid retention and possible electrolyte imbalances. For the central nervous system, it can include steroid psychosis and mood swings. For the endocrine system, hyperglycemia can occur as well as carb intolerance. For the GI system, that ulcers with perforation can occur, as well as pancreatitis. So usually oral steroids are given with food. So that's a little nursing implication that you can remember, or teaching point. For the integumentary system, it rashes can occur, facial flushing, or poor wound healing. For musculoskeletal system, osteoporosis can occur. And then for just ocular, which is just kind of random, it can increase intraocular pressure. So there's a whole lot of different things that can happen to your patient while they're taking adrenal drugs. They're all right here. This is the body system that it affects: endocrine, GI, integumentary, musculoskeletal, and then ocular. And there are a few teaching points for adrenal drugs that you don't give them SQ. If your patient has an oral drug, that you tell them to rinse their mouth out afterwards. They need to avoid infectious people, that no sudden stopping because this can lead to adrenal crisis. Take them with food at the same time, and they do not take them with alcohol, aspirin, or NSAIDs. So those are your teaching points. Specifically for the one drug over here in the mineralocorticoid section, fluorocortisone acetate, that drug can be used for Addison's disease, contraindicated in patients who have systemic fungal infections, and then adverse effects include adverse effects are related to water retention, so heart failure, hypertension, increased intracranial pressure. So those are the drugs for the endocrine system. Remember, we have them divided: pituitary, thyroid, and adrenal. Yeah, I mean, there's a lot going on here. Adrenal drugs have a ton of adverse effects, so I wouldn't spend a ton of time remembering them all. I mean, mainly I'd remember that hyperglycemia can occur. Vasopressin over here in pituitary is for emergencies, while desmopressin is for stable situations. There's a ton of drug interactions with levothyroxine, however you say it. And yeah, there we go. That's the endocrine stuff.